When building out a financial and retirement plan, looking at the date of death is of utmost importance. And of course, nobody likes to talk about the day they're going to die. A, we don't know when we're going to die. And B, it's just a topic of conversation that no one wants to discuss. But it's of utmost importance when you build out your retirement plan. A lot of us get caught in kind of an emotional and psychological decision of saying, well, I know someone that died in their 60s or 70s, so I'm going to make all of my decisions based off of that information. And we don't look at the bigger picture and more data behind the numbers. So today we're going to share a little bit of those numbers and talk to Scott McManus. And Scott McManus is an actuary in the pension industry. So who better to talk to than someone that deals with these numbers day in and day out? So we don't want to just look at numbers, how long you're going to live, but the trends and why the trends are important. And when Scott sent me a bunch of information, which we've linked below here, I encourage you to read through it because I can see why, people in their 60s and 70s think the way they do, and the people in their 20s and 30s think the way they do. Because statistically, obviously, the younger people are going to live longer, into their 90s, a lot of them into their hundreds. But if you're 60, 65, maybe a little younger, like most of our viewers are, when is the best time to plan for death? Because that ties into when you should take your CPP or OAS, kind of how you build your whole retirement plan. It's a very, very important decision. I've said many times on this channel that when you hit retirement and you start working on a retirement plan, it's about 10 to 20% financial, and the rest of it's psychological and emotional. And when we talk about life expectancy, it's 100% psychological and emotional. We talk about someone we know, both our parents died early. There's always someone close to you that died early, and we really lean on that. We don't lean on the, late 80s into 90s, those people that lived into their hundreds that are close to us, because that's the anomaly. Well, the reality is both sides might be. And so what's that middle ground? So let's welcome Scott McManus to the channel. Scott does a great interview for us, talks about life expectancy, the trends, and how you should look at building out a retirement and financial plan based on the data. So thank you, Scott, for joining us today.
I'm happy to be here and join you on the channel. I'm a pension actuary by training, and so I've had a great opportunity in my career to spend lots of time talking to very smart people and researchers on the topic of how long people are going to live in retirement. I think it's very interesting. I've stumbled across lots of interesting findings and observations in the course of my career, and I'm just delighted to talk with your audience about it today, and hopefully they'll find some things that are interesting and helpful, hopefully both.
I'm sure they will, because most of our viewers think they should take CPP at 60 because they're going to die at 70. So part of this is just bringing light to the fact that people do live longer than they think, and that we need to look at different numbers than maybe a lot of us are currently looking at, which again, we'll put some links below in this video. But Scott, just tell us a bit about longevity in Canada, the emotional psychological trap that a lot of people fall into. And again, most of our viewers are in that 55 to 65 range, and they're, when should I start CPP? When should I start OAS? And they say, well, when I was born, my life expectancy was 72, so I should just take CPP at 60. And that's not really the numbers or the case anymore, I assume.
Yeah, it's a great question. I think that one of the things you touched on there is that there's lots of public information. You'll read articles, you'll see updates on the news about how the world is changing and what that means for life expectancy, and that can mislead people who are approaching retirement, who are really needing to be focused in on today. Hey, I'm 60, I'm 65, I have to make a decision about my CPP or other pension benefits, and it's really what matters is how long you expect to live from 65. So sometimes those publications or public information about life expectancy at birth can give people the wrong impression. Now, one of the most interesting studies that I ever stumbled across, and it was published by Stanford and was very focused on US retirees, but I think that this study has been replicated with different groups of older folks around the world, is that there's a very pronounced trend of people underestimating their life expectancy. So when people are approaching retirement, if you go out and you poll and you get your hundreds and thousands of people and you ask them how long they expect to live, you compare that against the best available data that the demographers and actuaries and other skilled professionals have, people just have a very strong tendency to underestimate their life expectancy. So that's something that we know. I think when we try to dig into why that's the case, it's a little bit more speculative, but there are definitely some trends that we see, in talking to people that I think drive that outcome. One of them is what we just talked about, they may have some life expectancy at birth number in their mind that is not the right thing to look at whenever you're 65. Another factor that definitely impacts that is people get anchored on certain things that they see happening around them. So it's not an instinct for a typical retiree to try to find sources of data and research from actuaries and demographers about how long people are going to live. People live their lives, and that's where they get their impressions, and maybe they might be the wrong impression. I think one thing that happens quite often is people get a little bit anchored on the age that their parent passed away. So if you're approaching retirement, there's a fair chance that your parents will have predeceased you, or will be maybe in fairly poor health later in their own retirement. And what that really misses is that longevity improves over time. Like in the 20th century, we were seeing trends where your life expectancy at age 65 was kind of climbing by like 1 year per decade. So that doesn't sound very fast, but demographers and actuaries do in terms of decades. And that's a big difference, right? Like if your parents are, say, 30 years older than you, which wouldn't be out of the question, or even 20, on average across the board, in all likelihood, you're going to live 2 or 3 years longer than they did. And if past trends continue, again, 2 or 3 years may not sound like a lot, but I mean, as well as anyone, Adam, you start changing the time frame in which you have to be ready to have income in retirement, and it matters to your retirement income making decisions.
Yeah, it's amazing how many people mention to us like, oh, my dad passed at this age and his dad passed at this. I'm like, okay, like how are we going back to the 1800s here? Like how far are we going to go to look at like your life expectancy that you think is going to happen? And also like some of the data too that you sent me is, I was really curious to see, and it was true in that women used to live a lot longer than men, and that trend is narrowing as well, which is important too, because guys always think, oh, my wife will live 10 years longer than me. Not the case anymore.
Yeah, I mean, it's also a very interesting observation. I think that has been I'll call it a feature of longevity analysis for a long, long time. It's like, across many countries, many different kinds of economies, for many, many decades, women on average have lived longer than men. I think if you go back to the earlier part of the 20th century, that may have been rooted a little bit in the composition of the labor force. So jobs on average back then were more dangerous and would have longer, more long-lasting impacts on a person's health, adverse impacts on a person's health, and the workforce composition was more weighted towards men, in the early 20th century. That's kind of eroded over time. I think that, if you want to bring this back to thinking about what people should expect for their own life expectancy, you're a Canadian, you're approaching retirement right now. We have some very good data available, sources like StatsCan, sources like the Canada Pension Plan's actuarial team. They do fantastic work on setting assumptions about how long we're all going to live so that they can run our programs the most effectively. They publish information too. Like we can go find it. People like me that do this for a living, we're looking out for those reports and we're reading them all the time. The most recent actuarial report from the CPP actuary does go into this, and they provide lots of useful information to kind of distill it down to something that might have some meaning for your typical Canadian approaching retirement, and to touch back on this question of men versus women. The last report was showing, as of 2022, life expectancy of a 65-year-old woman entering retirement would take them to about age 89. And for men, the expectation would be about 3 years shorter than that. So the gap is still present. Like you say, it's been closing over time. But I think that, anywhere in that range, if you're retiring and you need to make the kind of one-time irrevocable choice that you've got to make, like with an OAS or a CPP, you want to make that decision on kind of the best estimate that you've got of how long you're going to live. And the best estimate that we've got for your typical person is going to be somewhere in that age 86, 89 range.
Feedback I get mostly from people is, life expectancy is 81 to 84. And so again, that's a big skew. Like planning to 81, 84 is very different, and will change the decision potentially around when you take your government benefits and how you kind of live your retirement income versus 86 to 89. Like that's a big shift.
Yeah, I mean that you're talking about planning for almost a decades of extra spending of income needs in retirement, and it does make a difference. And I think it is important for people to be aware that there are these kind of biases that we see in people's approaches, and none of us are immune from it, right? And I honestly have a lot of empathy for people approaching retirement. You got to make these one-time choices. The impact of that choice will last you a lifetime, hopefully a long lifetime. And like honestly, as much as an actuary, I'm pulling a lot of these questions down into Excel spreadsheets and data tables and charts. It really is an emotional decision, and even actuaries are not immune from psychological forces or emotional forces that can impact the way we think about these things. We're talking about our own mortality. It's a very personal issue. It's a very emotional issue, and I would just encourage people to try to avoid some of those pitfalls when they're making these big decisions early in retirement, and kind of recognize that where things can go wrong, where you can think that you're more likely to pass away earlier in retirement than you really are. The truth is that based on the mortality rates that we can see in the Canadian population, what we know about broad-based trends, 8 out of 10, 9 out of 10 people that are retiring and between 60 and 65, they're going to make it to 75. So if you know that you have a very serious health problem that makes you different from the average, retiring Canadian, that's a different matter. But if that's not the case, you really should be planning around living into your late 70s at least, and on average into your late 80s. And to get to another aspect of the longevity, kind of situation or challenge, is that probably a third of men, maybe a little bit more than a third of women, are going to be getting into that like age 90, 95 type range. So the risk of outliving your savings starts to come into play. Very difficult problem to address and deal with, but it's on the table. There's some solutions out there. Even doing things like deferring CPP and OAS, which, as you've talked about on your channel, Adam, is often a good financial decision for people to make, even assuming a kind of more standard longevity. I mean, by doing that and increasing that pension amount, you're also increasing that amount that's guaranteed to be paid for you for life. So that takes a little bit of that tail risk off of the longevity. If you live a very long time, those payments are still going to be there.
And growing with inflation and protecting you, right?
Absolutely.
And it's funny how everyone wants that defined benefit pension plan now, and not many people have, unless you work for the government or big corp. But when you talk about CPP, saying like everyone's got a defined benefit pension plan in a way. It's a little bit different, but in a way that's what it is, especially later in life. And so again, a lot of the talk that I have with people is, we're gonna die early, but very few talk about what happens. Like if the average is 86 to 89, that means that some are living longer into their 90s, right? Like what's the concern? Now the spending isn't much. Like we do have some clients in the 90s. I have a client that's 98 years old. His spending is very low, but if you haven't kind of delayed that CPP and OAS, you've burnt all your money, it can leave you in a pretty precarious situation. So again, that is another reason why potentially you might want to defer that CPP, amongst a million other things. What's interesting, and one of the charts that you sent me here too, and again, we'll link this all below so people can look at this themselves, but the probability of a newborn living to age 90. So in 1955, which would be around a lot of our viewers when they were born, male was 33% chance of living till 90, female 45% chance. If you were born in 2015, so as the generations go forward, it's 53% for male and 63% for female, like substantially higher. Again, as we keep planning going forward, so if you're watching this video and you're a bit younger saying, I don't have to worry about this, like it actually is going to affect you even more. Like you said earlier, like it's a year for every decade. That keeps compounding itself going forward. So we're going to see at some point a lot of people living into their hundreds. And I guess a lot of that, I assume, is technological advances. Like medicine and all that is getting much better. We're living longer. Things that used to kill us, there's cures and medications for now.
Yeah, that's a big part of it. I think that just shifts in the composition of the workforce matters as well. More office workers and fewer minors does contribute to the way that people's lives play out and how long they live in retirement. We'll see. It's a big unknown. There are different competing forces. It's getting more and more challenging for healthcare systems like Canada's and others to keep providing care at the levels that they've provided in the past. On the other hand, something like 80% of people that die in retirement are dying from heart disease or cancer. So a real big medical breakthrough in either one of those things would be a game changer. We don't have that crystal ball, but we can see that in the 20th century we did see that trend. of mortality improving, longevity improving by about a year every decade. That may or may not happen in the future, but it does make sense to plan for it. The fact that that trend was across global populations, we saw it in Canada, the US, the UK, Japan, other parts of Europe, those are all very different economic systems with different lifestyles, different ways of living, different economies, and that trend was persistent. So, it does really seem like this is sort of baked into the human condition, is that we're finding ways to live healthier lives one way or another on average, and that does make people live longer.
Yeah, well, that's fantastic. So if you were to merge your side of the world and financial planning, retirement planning, what's maybe just a good piece of advice for our viewers as they move forward and they start planning for retirement? Because again, I always say retirement planning is 10% financial and 90% psychological. And I truly believe that life expectancy and what you do for a living is such a big part of that psychological piece. So how can you kind of maybe a tidbit of advice to help our viewers just moving forward, making decisions around what to do when?
Yeah, so I would say number one is just be aware that there's this tendency to underestimate longevity. So if challenge your own assumptions around that, because that's a trend. We're all susceptible to that kind of thinking. Apart from that, I think what you're looking at is coping with the uncertainty. Even though we know on average that people are going to live until their late 80s in Canada, going forward, for any individual household, people might live longer than that. They might live less. So that could involve talking to some kind of insurance agent about the options that are available for someone to add to their retirement portfolio, or running a few different scenarios. So I've seen on your channel lots of interesting examples, Mr. and Mrs. YouTube, living to age 90. You could also, while you're doing that, just test 100, just so you know what that means and what happens. And if people are getting into their 80s and they're relying on a plan that they made when they were 60, 65, perhaps revisit that, because the situation has changed. If you had a life expectancy of 90 when you were retiring, and now it's more than that whenever you've made it to your 80s. So
yeah, absolutely. And often we'll do kind of the stress test for clients saying, like, if you live till 87, like typically when we build a plan by default, unless the client asks otherwise, we do tax planning to 87. So try and create an estate tax of 0 by 87. And then we do income planning till 95. So we always say, if you die when you're supposed to, we plan for that. If you keep living, we've also planned for that too. But when there's a concern of, well, what happens if one of us passed away tomorrow, right? Well, we can run that in a financial plan. We can knock one of you off and see how is the other person doing financially without you. And you can run both sides, right? So, if you're someone that's entering retirement that I think I'm going to live normal, like I feel healthy, but what if? Have your financial planner run that for you. Like it's not that difficult to do, to just knock one of you off or knock yourself off. And we've had a lot of people on the channel post comments of, I'm single, and if I die, no one gets my CPP and it's just gone. So I want to take it now, so at least we get something. But you have to take care of yourself, and taking care of yourself probably isn't taking CPP early. So there's a lot of factors. Again, the psychological side is a tough one to break for many clients. So Scott, I want to say thank you so much for joining us. I know this is a big, heavy topic for a lot of our clients, and something that a lot of people need to spend more time digging into. So again, we'll put those links below that you shared with me. I encourage our readers to read through it, look at the data, educate yourself around this topic before just making an irrational decision based on what your coworkers or neighbors or kind of your circle of friends have made their decision off of, who haven't done any research either. So yeah, thanks again, Scott.
Oh, you're very welcome. I'm delighted to talk about this topic. I think it's very interesting and very important.
Yeah, well, we'll get you back on here again one day soon.